Hi, my name is Kate and welcome to our channel. Today we're going to have a conversation with Dr. Tracy Cooper. He is an international consultant for highly sensitive people, professor of education at Baker University. He is an author of multiple books about high sensitive people, and he is also a co-producer of the recent movie who is going to be released this year together with the Emmy-awarded director Will Harper on Highly Sensitive Men Rising. We're going to have a conversation about highly sensitive children and parents, and also about high sensation seeking highly sensitive children. So I hope you will enjoy the conversation, and if so, don't forget to like it and subscribe to our channel.
The parents who are going to watch our video, they would probably be curious, how do I know, and what are the signals or whatever clues I could get as a parent to understand that my child might be a high sensitive child?
Right, and that's such an important one, Kate. When you think about the trait and the way I described it, so if you have a person who experiences the world in a more profound way, in other words, they tend to be more impacted by things around them, you can see how if you're looking in the eyes of a child, does your child experience the world in a deeper way? Do they tend to be more reflective? Do they tend to be less impulsive? Do they tend to be easily overstimulated by things? Were they a grumpy baby, a grumpy toddler? Did they tend to be fussy? Those kinds of things. But also, did they tend to be curious? Or were they interested in the world? Did they ask really insightful questions? And those are some of the signs of being a highly sensitive child. And there's also a self-test that you can take on Dr. Elaine Ayer's website. Those are the gist of the questions as they look at the way the trait works itself, how that manifests in a child, and how you can recognize that kind of deeper processing, that overstimulation tendency, the high empathy, like do they relate to other people well, more so than people their own age? Are they intuitive? Do they know things without really knowing how they know? Are they able to pick up on subtle cues that other people are not necessarily? Are they perceptive? Are they unusually perceptive? Those might be clues that your child's highly sensitive. Do they need a lot of downtime? Those are also clues.
Let's imagine I'm the parent of a child, and the child is 2 or 3 years old, the toddler, many of them have like high emotions, tantrums, all this kind of stuff. How do I not mix what is the stage of the brain development, let's say, and what is the part of the trait?
Right, so toddlers, it tends to be a challenging time for all parents, and myself having raised 4 children as well, I know what that is like 4 times over. And now I have 2 grandchildren, so I know what that's like again. And what is this, a toddler, and what is maybe perhaps a highly sensitive child? And I think it's a little trickier to understand, but I think understanding the trait yourself as a grown-up and as a parent, and then looking for those signs, is your child, does he tend to withdraw a little bit? Does he need that quiet time? Does he tend to be more easily overstimulated in some way? And toddlers in general tend to be overstimulated sometimes more easily than older children. But does your child, if he's in a group of people, does he tend to want to withdraw from that after a period of time? Because we should say that 30% of highly sensitive people are also extroverted. So that further complicates. 70% are introverted, 30% are extroverted. So if your child is more outgoing, maybe he tires before other kids do that are outgoing and wants to recharge, or maybe he's more thoughtful in the sense of, does he ask questions about how things work, very curious minded. So not mixing the two, I think you'll see it as your child gets older. There's also just a kind of a subtle presence of highly sensitive children. They tend to be not only kind and compassionate, but they tend to have a special sort of spark, a special depth of being, if you will. It's almost a spiritual spark.
Let's say somebody has a high sensitive child. What would be their, top 3-5 ideas how to, raise or parent this child? Or what would be really helpful to help this child to thrive and not to be stigmatized or abandoned or neglected in any way?
Right, not a small question, Kate. So let's talk about a couple. Let's talk about just a couple of them. So we should mention the concept of differential susceptibility here. That is, that people who are highly sensitive tend to be more affected by negative environments. So if there is a chaotic environment or a traumatic environment, or even a noisy environment, or a lot of things going on, that tends to be far worse for the highly sensitive person than it does less sensitive people. But conversely, if you are in a supportive, positive, loving, nurturing environment, that tends to be far better for the sensitive person than it does for less sensitive people. So that's the encouraging thing about it, is if you can create that positive, nurturing, loving, supportive environment, that's the environment you really want to maintain, at least on the average. Not in all cases can it be a perfectly positive environment. That's not real life. But you really want to work to focus on having a positive, supportive, loving, nurturing environment as much as possible, because that's going to be far better overall. Interestingly, creating that environment for the sensitive child is also good for all the other children as well, no matter where they fall on sensitivity. That environment's going to work for every child. So the highly sensitive child, in a sense, is the canary in the coal mine, if you will. They're going to sense things being off sooner than will less sensitive people. In that respect, if they're upset, if they're emotionally activated, they're probably registering something before other children are. So the high emotions and everything really have a purpose. It's just children don't have a way to process that yet or attach names to it. So I wrote down a couple of things I think that are really important for sensitive parents of highly sensitive children who also may be highly sensitive themselves, because it tends to be heritable. So you probably inherited high sensitivity from one of your parents. And one of those things is validating your child's big feelings, right? Those high emotions tend to be overwhelming. So if you can help your child to name those feelings and come to understanding of, okay, this is sadness, this is happiness, this is overwhelm, this is excitement, whatever the case is, because your child doesn't have that vocabulary yet. And also make it okay for them to experience all those emotions and not say you need to stuff those emotions away, particularly if it's a boy. You really don't want to tell them, oh, just forget about that, don't cry. You really want to allow them to experience all those emotions, because it's part of being human, fundamentally being human. And boys fundamentally are also raised a little bit differently than girls are. And it creates all kinds of problems, as we know. So we really want to focus on the environment itself that's going to work for whether you're male or female. That's supportive. So validating your child's feelings, that they're experiencing them, understanding that the whatever the experience is, it's transitory, it's temporary, it'll pass. So gaining some experience with emotions themselves and feelings, that they're not who they are, they don't represent who they are, and that they won't last. That makes it a little bit easier for the children to understand, wow, I have these big emotions, but if I learn to calm myself, I learn to be in the present moment. You can teach them some meditation, some calming exercises, go out in nature, do something to blow off the steam, ride their bike, whatever the case. But you don't want them to not understand their emotions or how to deal with them. So you really want to teach them to center themselves and bring themselves back around to a calm state. You want to engage that parasympathetic nervous system so that they have that calm. Another one is you want to be consistent and direct. So in your parenting, you really want to be consistent, and you want to be direct in the way you communicate with your children. Sensitive children thrive in structure. Since we tend to have some problems with the unknown, that is, we like to pause to think before we do something, structure tends to work really well, and structure works well for children in general. For sensitive people, they like to know the predictable. They like a predictable routine. So there's not these unknowns that stimulate overstimulation. So there's not that anxiety about what's going to happen next or what can I expect. They like to know what to expect. They're incessant planners. So when they have a structure and they kind of know what to expect, they can thrive in that structure. And that's true even into adulthood sometimes. As much as we prefer autonomy, and that's a human need, sensitive people also do well within a structure. So when we have those clear expectations and when people are direct in their communications, but without being hurtful, right? Direct communications doesn't mean that you're criticizing the person, but rather critiquing something, right? Providing feedback. There's a difference between the two. So we talked about structure, consistency, being direct. And you could consider conscious discipline, which is kind of another facet of conscious parenting, as a whole field called conscious discipline that you can look into. It really has to do with not only leading from a place that doesn't involve ego, yourself as a parent, but rather providing opportunities for the child to come to not only understand themselves, but make choices and to grow as an individual as a result of that. So I think parents should all look into conscious discipline for highly sensitive children, but also for all children. Another one is positive feedback is especially good. So we talked about differential susceptibility a little bit. So when we're able to begin a conversation with a positive and then lead into the critique, that tends to be better for a sensitive child. So if you lead in with the negative, that's all they're going to see. That's all they're going to feel is that negativity. So you really want to approach that in a way that, hey, you're really good at this, but there's something else that you need to talk about. And I would always say wrap it up with something positive at the same time. So kind of a compliment sandwich tends to work better for sensitive children, so that they're left with that positivity, that you have their best interest in mind, that you're not critiquing them as a human being or criticizing them personally, but you're providing feedback that allows them to make choices, better choices, if they need to make better choices. Those are a couple. I have other ones too, I think, that are really useful for parents of sensitive children, or parents in general. One is teach your child about their temperament. If you're a highly sensitive person yourself, you definitely need to know how the trait works. If you are a high sensation-seeking, highly sensitive person as a parent, you definitely need to know how both of those traits work. And if you suspect your child is highly sensitive, you need to educate them on how the trait works and what it kind of looks like for them at this stage of their life, and kind of how that plays out, how it's played out in your life and how it might play out in their lives. So you want to emphasize things like self-care, the ability to self-regulate, keep their emotions not in check, but allow them to experience their emotions, but also understand that emotions are passing and fleeting, that you can bring yourself back to a state of regulation, not a state of emotional dysregulation. So that's an essential skill to teach, as much as the other aspects of self-care are as well. This is the basic fundamental things, like maybe they're hangry, they're hungry and they're angry at the same time because they're hungry. So you want to teach hydration and what is a proper diet, and what is get out and move your body, because your body needs to move. It's the proper exercise, getting enough sleep, high quality sleep. So all of those kind of basic fundamental things go to do or have to do with keeping in a balanced state. And those are all important for us as parents as well, but teaching your child about their temperament, and this is how you function, and then be able to contrast and compare it. Unfortunately, when they hit school age, that's when the big contrast will really start, and they'll start to compare themselves. So there's something that Dr. Elaine Aron talks about called ranking and linking. So humans, by nature, compare ourselves to other people. But when we do it in a hierarchical way, in other words, when we're trying to figure out where we are within the hierarchy, someone above us or someone below us, then we're not connecting with those individuals. But when we're linking with people, when we're engaging in linking, we're actually moving laterally. So we're making those connections and networking and those friends and those colleagues and people who could support us. So we really want to focus on linking rather than ranking. And it's a human predilection to engage in ranking, but it's actually destructive for us as human beings to do so. It's useful at the same time because we want to know who the president is, for instance, or we want to know who's the principal of the school, or who's the mayor of the town, or who serves what role. Otherwise, we wouldn't know who does anything. So we need a certain amount of that. But in general, we want to engage in linking so that we are building those networks, and so that we have that social support. And we want to teach our children the same things. Another thing is seeking out support for yourself as a parent. It's important to not kind of suffer in silence. If you're a new parent especially, you really need to seek out some support, either from family or friends or other parents. It's one of the things I'm so encouraged about with younger parents is, particularly millennial generation in America here, is they tend to have friends that they've had since elementary school, which I think is amazing. And so the women now out there, millennials, sometimes have these relationships they've nurtured for 20 plus years, and now they're mothers. And so they're able to support each other through this journey. And a lot of prior generations didn't necessarily have that. So seeking out support for yourself as a parent, because parenting is hard, as we mentioned at the beginning of this interview, it really does help. And there are more resources available now than there used to be. It helps to really think about your child, if you have a highly sensitive child, in terms of growth potential. That this is an individual who's a beautiful individual, but it's going to hopefully continue growing throughout his lifetime. So you want to really patiently build up your child. You want to build up that resilience, you want to build up that curiosity, and most of all, you really want to establish that firm foundation on which to build. So you want them to feel secure in you, that you'll respond to their needs, that you're able to take care of their needs, and that they can come to you when they have a problem, or when they want to discuss things, or when they want to get some feedback on something that they're thinking about. So that firm foundation is really so important. And that really brings us to meaningful activities. The more that we can provide those meaningful activities for our sensitive children, really the better it is for them, because it goes to a positive environment again. And that facilitates a growth orientation. So you really want to build that growth orientation for your child. But at the same time, you really want to provide opportunities for time and space to rest. So we don't want to be the kind of parents that are pushing, but rather allowing them to discover their interest over time, but also ample opportunities for them to rest when they need to, or recharge in quiet. These are good points for anybody. For a sensitive child, they're absolutely critical. And this one is a general one too, but it works so well when you consider creating that positive environment, collaborating with your teachers, coaches, and other people that interact with your child. So sometimes parents can think of teachers, unfortunately, as the adversary, and you really need to think of them as collaborators, because they really are working to invest into your children, their growth potential, that growth orientation. So you really need to talk with your parents or your teachers and coaches and people that interact with your child, so that they understand how your child functions. You can describe, oh, he's more thoughtful, he spends more time in reflection, or he gets overstimulated before their kids do, and he may need a little time. So teach other people. You have an advocacy role if you have a highly sensitive child, to teach what it means for a sensitive child. And not everybody will understand that, so it's up to you to explain how your child works and how they function at their best. And they tend to understand that when you explain it that way.
Yeah, and I think that's really super important what you're saying, because they don't come with the manuals, and some people around and adults might not be educated on these terms. And let's say it's not only about school or after school activities, it could be like more other family members, extended family, grandparents, etc. So they might be raised in completely different paradigm of how kids should be raised. So that's good to educate them as well to some extent, I think.
Absolutely, yeah. It's when you're
so they not get upset when your child just screams at his grandpa, and just because he's overwhelmed, and that's not because he's rude.
Right, and it doesn't mean that he has a problem either. Right, it doesn't mean that he doesn't need treatment for anything. He's just a sensitive child that maybe is overwhelmed for some reason, and he'll probably regret it later if he yells at somebody, because he's probably more compassionate, more empathetic.
That's true.